There is an increasing amount of talk about insulin prices, but that's mostly in the US. It's understandable because prices of insulin are extremely high in the US. A study in Boston recently found that long-acting insulin is around $300 for a 10 mils, which is roughly a month's treatment. But even human insulin was over $100, around $100 for 10 mils supply. But what we find though is while there is talk about the problem in the US, there's little attention being paid to the price and affordability and availability of insulin in low and middle income countries. We've done some studies in low and middle income countries, and we've found some very high prices, variable prices across the countries, and there are real issues of affordability, particularly for those on low income. As an example, in Ghana, the government is paying about $8 for 10 mils of 100 units per mil insulin. Now, for that same, this is for pre-mixed insulin, it's a human insulin. That same type of insulin, we've seen a variation between $2 in some countries to up to about $23 or so in others. So wide price variations for the price paid by the government across these countries. But what about patient prices? Well, we've seen in Ghana, in the public sector, availability of about 67% in facilities, and patients are paying on average about $8. Now, $8 is a lot less, of course, than the US price, but what's really important is whether or not that $8 is affordable. And we looked at, well, how many days would the lowest paid unskilled government worker have to work to be able to buy 10 mils of insulin? And in Ghana, that is about 4.5 days' wages. So it's 4.5 days every month they would have to spend on buying pre-mixed insulin. Now, if it's unavailable in the public sector, they're forced to private pharmacies and other sectors to buy their insulin. In Ghana, in private retail pharmacies, the price is about double. It was about $18 for 10 mils. That's 9 days' salary. So you'd have to work 9 days to be able to afford it, and that's clearly unaffordable. Even in the public sector, having to work 4.5 days is unaffordable. So it clearly shows, and this, while I'm talking about Ghana as an example, we see this in many countries that we've studied. And clearly a lot is needed to improve this. What insulin users need, it needs to be available in the facilities and it needs to be affordable. And we need to do a number of things to improve that in countries.